Hello, and welcome to our Ask the Advisors webinar. We're so excited to have this chance to answer some of your questions and share with you some of the common issues that have come up over the past year. My name is Mary Catherine, and I've been a physiotherapist for 28 years. I started my career in Ottawa and moved to Winnipeg, New York City, and am now in Toronto. I've worked in hospitals and rehab centers, and I've spent the last 15 years in my clinical practice as a director of a multidisciplinary clinic in a private setting. I joined the college as a practice advisor in March of 2020.
Hello, my name is Fiona Campbell and I was a clinical physiotherapist for over 15 years. I'm educated in the UK and I moved to Canada over 20 years ago. I enjoyed working mainly in acute care and then rehabilitation. I have been at the college in a couple of different roles for more than 10 years.
The college's advice team, which is made up of myself, Fiona, and Kirsten Pavlich, who's a physiotherapist in Thunder Bay, is available to assist not only physiotherapists registered with the college, but also students, PT residents, PTAs, employers, insurers, as well as patients and caregivers. We'll provide you with information about the standards and rules for the PT profession and how to apply them in your specific scenario. Anyone can contact us at the college for free practice advice. Je peux aussi répondre à vos questions en français si vous préférez. Our answers that we provide to you will be based on the information that you provide to us, and our advice is of course not a substitute for legal advice. We are physiotherapists ready to answer your call or email, and you can ask us anything related to physiotherapy. If you call with a question that we are unable to answer, we will do our very best to direct you to the right person or place outside of the college who will be able to help you. Call or email us with questions about rules or something that you're looking for on the website, or maybe about a clinical dilemma that you need to talk through. We're available for a live call Monday to Friday from 8:30 a.m. to 5 p.m., and we aim to answer emails and calls within 24 hours.
So there are 12 standards. You can access them from our website, www.collegept.org. You can go to the resource standards and resources at the top. There's 12 of them. We've made them concise. Most are no more than a couple of pages long. You need to know and you need to be able to apply the standards to your practice, only where relevant. So if you don't perform controlled acts, you may not need to know that standard quite as in depth. If you don't work with PTAs, then you don't need to know the working with PTA standards as in depth. So based on the questions you've been asking the practice advice team, we're aware that privacy, setting professional boundaries, business practices, supervision, COVID-19 related questions, and virtual care are the areas of most interest to you. We'll be covering these today using real scenarios that you've written in with or you've called us with.
So Fiona, our first question is about privacy. A patient that a physiotherapist had finished treating around 2 years ago has requested a copy of their chart. What steps should the physiotherapist follow?
Well, patients should understand how their personal health information will be collected, used and disclosed, and how they may access their own health records. So it's critical that you know who the health information custodian is for your records. I'll refer to that person as custodian. The custodian develops the policy around how and when the patient's chart should be released. The custodian should be notified of the request for the chart and released as per the custodian's written process. If a patient requests a copy of his or her record, the copy should be provided within a reasonable time period. A fee may be charged to recover costs. The cost should be reasonable.
And what is meant by a reasonable cost?
So when charging for copying and transferring records, PTs must provide a fee estimate prior to providing a copy, and also provide an itemized bill that provides a breakdown of costs upon request. So the cost per page, the cost for transferring of the document, the time that it took to make the copy. So a few years ago, the Ontario Privacy Commissioner said that $30 for the first 20 pages and then 25 cents to copy a page after that was reasonable a few years ago. Also, consider how you're going to send the copy of the patient's chart to the patient. Will they come to pick it up in person, or will they need to mail to them or electronically? Now, the Privacy Commissioner has guidance around safeguarding personal health information, including how to transfer it securely. They recommend using an encrypted email, or if using traditional mail, include a tracking number and the requirement for a signature when they receive the chart.
And what steps should the physiotherapist take to ensure confidentiality in the storage of patient records?
So records should be stored in a secure environment to prevent unauthorized access. This applies equally to paper and to electronic records. Reasonable measures should be implemented to protect from loss, from theft, from unauthorized access, use or disclosure or tampering, including copying or modifying or disposal of the record. This includes all components of the patient's record, such as the attendance record, the sign-in, the exercise program. So physical security need to, if it's paper, a locked filing cabinet, restricted access in the office, don't have records in hallways where patients or the members of the public could access, have office alarm systems. Technological security, some of the recommendations are password protection, encryption, virus protection or use of firewalls, and have administrative controls. Some of the recommendations also are security clearances, access restrictions, staff training, and confidentiality agreements.
So can I use email to communicate with my patients?
Email does offer many benefits, but it also provides or poses a lot of risk to the privacy of individuals and to the security of that patient health information in the record. The Privacy Commissioner, again, has useful information around the use of emails to communicate with patients. Risks include inadvertently sending the email to the wrong recipient by mistyping an email or using an autocomplete feature. Email is often accessed on portable devices. You need to think of smartphones, tablets, laptops, which are vulnerable to thefts or loss. An email can also be forwarded or changed without the knowledge or permission of the original sender. Remember, the patient should consent to email communications and exactly what type of information can be included in the email. Again, the Privacy Commissioner's website has a ton of useful information on security. Encryption technology is becoming more widely available and easier to use. Where encryption is not feasible, some considerations and alternatives are offered, again, by the Privacy Commissioner.
So what should I do if I've mistyped an email address and sent some patient confidential information to the wrong person?
So this is, remember we talked about the custodian. If you do not have or familiar with a privacy breach protocol at your organization, now is a good time to either ask the custodian develops one. If you're the custodian, you need to develop one, become familiar with that protocol. If larger organizations, hospitals will have, maybe medical records will have a privacy officer, similarly with home and community care support services. They should be contacted and you should follow their privacy breach protocol. Attempt to locate the lost file, contain the privacy breach, then contact the Information Privacy Commissioner about the next steps and your duty to report that privacy breach. If you're not familiar, again, with your privacy breach, do contact your custodian. After the breach has been dealt with, now is a really good time to debrief the issues surrounding that breach with your staff, with your team. Learn from the incident and share the lessons, e.g. put a delay on an email or always check the email address you're sending the information to. Try to build a positive culture around privacy safeguards in your workplace.
Great.
So maybe we'll move on to consent. That's privacy, and a lot of people ask about consent. So one of the questions we often get asked is the need to gain consent of a parent to treat young patients.
So in Ontario, there is no specific age of consent for healthcare. If the physiotherapist determines that the patient is capable of providing consent, it's not necessary to have a patient or substitute decision maker involved. A person is considered capable of giving consent to care if they understand the information needed to make a decision concerning the care, and they appreciate the reasonable possible consequences of giving consent to the care or refusing to consent to the care. So what that means is that young patients may be capable of providing consent for certain elements of care, but not for others, depending on the risks and benefits involved in the type of care and the patient's ability to appreciate potential outcomes related to receiving care or not. For example, if a young person comes in, they may be able to consent to the physiotherapy assessment, but they may not be able to consent to a surgery with uncertain outcomes. So check in with them often. Even if a patient initially consents, they can refuse treatment or change their mind about treatment and withdraw their consent at any time. Finally, you want to make sure to document in the patient's chart that consent was obtained. Include that information, such as the information that was discussed, what questions that patient may have asked, and remember that consent is really a conversation. It's not only about having a consent sign formed, and we want to see that there's been evidence of a conversation recorded in the patient's chart.
So does a physiotherapist need to get consent for the involvement of a PTA, of a student in a patient's care?
Oh, definitely. The supervising physiotherapist needs to get consent to involve any others in the patient's care. The others could include students, PTAs, as well as even volunteers. You should discuss their role and responsibilities with the patient as well as your own roles so that they understand which role each person is acting. You can have the student introduce themselves to the patient and explain their role as long as the patient understands who the supervising physiotherapist is and that they're available to answer questions the patient might have. So let's move on to one of the next big sections of questions and inquiries that we've had over the past year, and it's really about boundaries and how to manage challenging relationships within a clinical setting. So Fiona, I'm going to read out a scenario that was brought to us, and I hope you help us with the answer. So here's the scenario. A patient comes for their first physiotherapy assessment. They're quiet and withdrawn, and they don't ask a lot of questions during the consent conversation. After assessing the patient, I've decided that I want to include some hip joint mobilizations in the treatment plan. So I've explained my clinical reasoning to them and why I think it might be helpful, how a hip joint mobilization will occur, and how I anticipate it could affect their hip pain. And I also offer some alternatives to managing it if they prefer to not have a hip joint mobilization. The patient consents and agrees to going ahead with the suggested treatment.
So what are the important considerations to make that patient feel safe when they come to see a physiotherapist for an assessment or treatment?
Well, definitely ensuring a safe space is a critical part of managing boundaries in a therapeutic setting. Patients will feel safe if they're recognized for their unique experiences, including their culture, their age, their values, or any past experiences of trauma. Unfortunately, at the college, we're seeing an increasing number of complaints from patients who felt exposed and vulnerable during their physiotherapy session. So this means that as physiotherapists, we need to take the time to explain the proposed assessment or treatment technique. We need to make sure that the body parts are adequately draped so that only the important parts are visible and that a patient feels safe. Expose only those body parts that are necessary to ensure excellent care. You could use draping techniques that minimize exposure and ensure a patient feels covered and respected. For example, towels can be placed over a patient, protecting sensitive body areas. You could consider having extra shorts or t-shirts that are cleaned between use for patients to borrow to feel more covered up. Maybe you can also use pillows between yourself and the patient. Each barrier has a goal of making the patient feel safe. If you don't remember as physios how to do draping techniques, or maybe it was something learned a long time ago, or maybe it was something that was never covered in your training, we have videos on our website that provide instruction for these types of situations. I would encourage you to revisit these skills. Ongoing communication and the patient's ongoing consent are key. We also have a resource on our website called the Handbook on Sensitive Practice for Healthcare Practitioners. This is a valuable tool to take your learnings further around how to have a more trauma-informed practice in your day-to-day practice.
I've got another scenario, Mary Catherine, and that's about a patient. The patient's often angry, arrives late, and the physiotherapist is saying they're often rude to me and other staff at the clinic, and what can they do? Now, I just want to point out there is a blog from this year, November 2021, on this very scenario and how a physiotherapist actually very successfully deals with it. But if I can go over it now. No one likes to be involved in a challenging situation like this. It's stressful. It often leaves the professionals feeling uncomfortable or uncertain of their choices. Recognize the behaviours of both patients and physiotherapists contribute to the situation. But it is expected that when a physiotherapist finds themselves in a conflict, that they will take action to resolve and to manage the conflict in a positive and effective way. So if you find yourself in a challenging situation like this, the patient at the front, they're rude, they're demanding to be seen, but they're late for their appointment, how will you manage it? I would say the first thing is safety. Consider safety issues. Where are you in the location where you are? Are you safe? Is there other people around? Consider if you need help from your manager or from an outside resource if it's escalating to manage this situation safely. If you can manage the situation, you might respectfully take the patient to a place that's private and safe to discuss a way to manage that situation. Remember, the balance of power rests with you, the physiotherapist, and therefore, so does the responsibility to resolve the issue. So ask, what exactly is the situation? This patient, they've arrived, they're late, they're angry, they're demanding to be seen. Do you know if the patient is in a lot of acute pain? Does the patient value your need to keep times and to schedule appointments? And do they know that you have other patients available, other patients booked that day? Truly find out what's going on with them. Have they struggled for an hour to get across the city in order to get their physiotherapy appointment? I would suggest discuss the situation, but really listen actively to the other person's perspective. If you know the patient is in acute pain, they have traveled, they've struggled to see you, maybe you might be able to, you have the option of someone else seeing that patient if you are currently with a patient. If not, maybe you can try to schedule another available appointment. And you maybe want to plan to follow up with them later that day to manage them. So what you're doing there is resetting professional boundaries. Be clear you want to help, but the conversation between you and that patient needs to be respectful. Share the plan, whether it's to reschedule a convenient time or to see them or somebody else to see them that day. Give the patient an opportunity to work with you and to work with the new plan and the expectations around scheduling and having respectful conversation. Document the conversation you've had and what your plan was to manage the situation, and then monitor the results of that conversation. Did it resolve? Did you see the patient? Were they taken care of? Now I'm going to the standard for providing or refusing care. If the patient has been given the opportunity to be respectful or to come to another appointment or to be seen by someone else and the behaviour continues, it continues to repeat yourself, or if the behaviour escalates and you feel threatened, at that point, yes, you can discharge the patient. You'll provide alternatives to them, perhaps alternative clinics in a reasonable distance for them to be able to attend. and you'll document why you've discharged them in the patient chart. So MC, do we have any
Yeah.
other scenarios?
So we're going to move on from the managing challenging behaviors to business practices. So there's a scenario in business practice that a physiotherapist has a new job working in a private multidisciplinary sports medicine clinic within a fitness facility. They've never worked with PTAs before, and they've been told by the employer that there are personal trainers who could potentially work as PTAs.
So what should the physiotherapist consider when working involving a PTA with the care of one of their patients?
It's a great question. So the first thing, because that physiotherapist remains responsible for all care that they assign to a PTA, they need to assess the competency of that PTA. You want to be sure to obtain the patient's consent to working with an assistant, and you can only assign care that you yourself are qualified to deliver. You want to make sure that following that working with PTA standards, you have a written communication protocol so the PTA always knows how to contact you. And remember that personal training is not physiotherapy.
My employer manages the billing at the clinic. What are the expectations for that physiotherapist as a physiotherapist when somebody else is managing the billing? Sorry.
Sure. So physiotherapists, as most of you know, have to maintain knowledge and control over how their registration number is used in billing. This requires us as physios to have a written process for auditing our billing. It means that periodically you should monitor invoices and billing practices to ensure for accuracy, and should any inaccuracies be discovered, that you take reasonable steps to remedy the error. The remedying of the error may include reaching out to the patient, to the funder, or to both. And a record of the error and how it was remedied should be included in the patient's record. We have examples of billing audits and what they can look like on our website under the Standards tab, and you look up Fees, Billing, and Account Standard. By the way, discussing with a new employer how they will allow you to monitor your billing is a great way to ensure that you're joining a business with ethical business practices.
A physiotherapist wrote in, I am a certified yoga teacher. Can I use my name and registration number on the invoice so everyone at the facility can be reimbursed under physiotherapy if they attend my yoga class?
So no, you can only use your name and registration number to bill for physiotherapy services. Not all services that you provide are necessarily considered to be physiotherapy treatment. However, if you have assessed a patient and determined that a specific yoga session may benefit the patient's condition and you plan to follow up that session with a reassessment, it might be okay to include yoga in the treatment plan. Again, as a physio, you maintain responsibility for the overall management of the patient, and you want to work towards that patient's goals and potential discharge from treatment. The college has adopted a zero tolerance policy for inappropriate business practices, so signing or issuing a document that is false or misleading could be viewed as professional misconduct.
So I'm still not clear. How do I know if something's physiotherapy versus fitness?
I know it can be a blurred line sometime, but here's what we look at. For a service to be considered as physiotherapy treatment, the patient must have had an individualized assessment. We want to see evidence of objective findings, a physiotherapy diagnosis, patient goals for treatment, a treatment plan, a plan for reassessment, and a plan for discharge. Remember that treatment should be evidence informed, and it should be justified by improvements in objective findings and evidence that the patient is moving towards achieving the goals of treatment.
So many people called in to ask about what's required if they're opening their solo business, either with a physical location or as a mobile practitioner providing care in people's homes. Can you talk to that a little?
Yeah, we've had a lot of calls about this, both from physiotherapists holding independent practice certificates and also from those PT residents. We have an excellent resource on our college website called Opening a Practice. It's a checklist, and it'll take you through what to consider before you see your first patient. One of the most important pieces will be around the fact that you will now be the health information custodian for your physiotherapy records for your patients. So you want to take the time to review the responsibilities of the health information custodian, develop a privacy policy for your business, and consider how you'll safeguard your patient's personal health information. Other considerations are to develop protocols around how you'll manage adverse events if you do any controlled acts. And of course, you should have written protocols for prevention, infection prevention, and control. You want to have a written process, again, for routinely reviewing the maintenance and safety of your equipment. If you're working with PTAs, you want to have written communication protocol for communicating with your PTAs. You want to inform your patients about the fees ahead of time before you provide service. And of course, you'll want to update your information in the PT portal. So we're going to move on. This is a nice transition to move on to supervision. Now we've developed a supervision table that was as a result of questions that we received from many physiotherapists for situations where someone joined a clinic as a PT student, and then they were so exceptional they were hired on as a PTA while they're waiting to write a part of the piece, they're in the first part of the PCE, and then they were hired on as a PT resident while they're waiting to complete the second portion of the PCE. So there are supervision differences between a student, an assistant, and a PT resident, and these are available on this table under the supervision standard.
So what should I consider before deciding whether to supervise a PT resident?
That's a great question. What supervisors should consider their own practices and the amount of time they will have available to support that physiotherapy resident they're agreeing to oversee. There are different supervision scenarios that all may be appropriate depending on your practice setting. So you could consider an on-site supervision of a PT resident, remote supervision of the resident, supervision of more than one physiotherapy resident at a time, or co-supervision of a physio resident with another physio. So think about the clinical environment of where the physiotherapy resident is working, whether there are other professionals available to help if needed, the types of patient's conditions, the types of risks, the level of competency, and the experience of the physiotherapy resident. If the supervisor agrees to only supervise the resident in one setting, for example, a private practice, and the resident wishes to practice in an additional setting, the physiotherapy resident should find an additional practice supervisor for that additional area. A supervisor can only supervise activities, again, that they are trained or even rostered to perform. And so, for example, a supervisor can't supervise a PT resident who performs spinal manipulation or suctioning if they are not also rostered for the same activity.
You talked about supervising a PT resident remotely, i.e. they're at another location. Can you talk a little bit about that?
Sure. So the supervision standard states that the physiotherapist must adjust the level of supervision in accordance with patient needs. Closer supervision is required in situations of higher patient risk. So some of the factors that could influence patient risk include the patient's condition, the clinical environment, and the abilities and experiences of the person under supervision. Some physiotherapy residents may be recent graduates, while others might have many years of experience in other countries and are simply new to Ontario. If you are considering becoming a supervisor for a physiotherapy resident and supervising remotely, virtual supervision can take many forms and should always involve the patient's consent if it involves direct patient care or the review of any patient's records. So you could consider, for example, having a PT resident observe you during a virtual session. Alternately, you could supervise a virtual session that the resident themselves are leading. You could use regular meetings to check in with each other. That'll give you a greater sense of control over remote supervision. You could, in these meetings, include things like a chart stimulated recall activity, or maybe review one of the college's online modules together, or ask the resident to demonstrate maybe a technique or assessment skill on one of their colleagues. Again, all of this will depend on the service area where the care is being provided, the risks to all involved, a review of organizational processes, but it could be it can be a decision that is a very rich and rewarding experience to supervise a PT resident. Finally, you want to make sure to keep records of your supervision to demonstrate the adequacy of that supervision.
So maybe you can comment on if a physiotherapy resident is struggling with a certain competency and you've identified what happens.
So as a supervisor, you do have the duty to ensure that that physiotherapy resident has the knowledge, skills, and judgment to deliver care with the same quality as you would. As their supervisor, you can identify what the physiotherapy resident needs to address in their practice and help to explain to them how they can demonstrate competency. You, as supervisors, may need to review the information provided to you by the college when you in your supervisor agreement. And if there are any concerns, you can contact us at Practice Advice or contact the our registration team here at the college. So Fiona, I have a question for you. If we're thinking about a physiotherapy student and supervision of a student, can a physiotherapy student perform a controlled act as part of their training?
Yes, they can if certain conditions are met. They're authorized to perform as part of their training to become a member of the profession. Before the student performs any controlled act, the supervising physiotherapist must be rostered themselves to perform that act, be confident that the student has the competency to perform that act, have the patient's consent or agreement for the student to perform that care, and provide an appropriate level of supervision and ensure safe and effective care to the patient. That's it.
Great. So thinking about controlled acts and delegating to someone, can I, as a physiotherapist, delegate the controlled act like oxygen titration to a PTA?
Yes, you can delegate oxygen administration to a PTA. Physiotherapists can delegate to anyone who has the knowledge, the skills, the judgment to perform administration of oxygen. This includes assistants and any other healthcare professionals the PT believes is competent to do so. The acts that can be delegated, if I can remind you, are administration of oxygen, suctioning, and wound care. But the acts that cannot be delegated, acupuncture, and this includes all parts, even removing the needles, spinal manipulation, communicating a diagnosis, and internal assessment and treatment of pelvic musculature. And remember, when delegating a controlled act to another person, the physiotherapist must make sure the person performing the act is competent, they know how to do it, they have the skill to do it, and they have the judgment to do so safely, competently, and ethically. You explain the circumstances in which the person can perform the controlled act, including the patient or the types of conditions that a patient has, the person can treat, and any other limitations. Ensure the PTA, the assistant, knows how to deal with possible adverse outcomes and has a written plan to do so, and confirm the person that you're delegating to understands they cannot delegate this act to anyone else. So please consider, we do have a resource on our website. It's the physiotherapy competency checklist when assessing competency and considering delegating this activity.
Do I have to be physically present to supervise a PTA?
Oh, the answer will depend on each unique situation. It's possible to supervise virtually. PTAs cannot assess or respond to changes in a patient's condition unless it's explicitly part of a defined care plan. You'll need to be able to rationalize why it's safe to supervise. Some virtually, keep in mind that working with PTA standard and applies to virtual care as well as to in-person care. So you'll need to ensure that the assistant has the competency, the knowledge, skills, the judgment to deliver the care safely. You'll also need to consider how the standards such as infection control, the equipment maintenance will be managed by you in a remote setting, accepting that you are responsible for these issues if care is being provided under your delegation and direction and using your registration number.
Great. So it will come as no surprise to any of you watching that questions relating to COVID-19 and the requirements of regulated healthcare professionals set by the Ministry of Health continue to be a top theme to practice advice. It's been quite a couple of years. So please remember that any of the answers that we provide today are applicable as of December 2021. Because the information comes from the Ministry of Health as well as Public Health Ontario, and this information is constantly changing and responding to the ongoing pandemic, we will continue to communicate our changes on our website as well as through the messaging in our Perspectives newsletter. If you're watching our webinar at a later date, please verify that the information remains current as of the date that you're watching.
So maybe I'll start with the first question here. Can I restrict in-person care to vaccinated patients only?
No, absolutely not. Inpatient care can be provided safely, even in the absence of a negative test result or vaccination, by taking appropriate precautions, including screening patients and using necessary PPE. While you can encourage your eligible patients to follow public health's advice to be vaccinated, patients cannot be denied access to necessary in-person care based solely on their vaccination status. Safety concerns can be mitigated by ensuring the correct safety precautions are in place. In very rare circumstances where you cannot provide in-person care to the patient, ensure that the appropriate steps are taken to ensure access to care. This could include using virtual care to provide that service, or help to redirect patients, or helping to coordinate with other colleagues who could provide that in-person care.
My patients are so tired of answering the screening questions. Do we still need to actively screen patients if we know they're vaccinated?
I'm afraid the answer is yes. I know everyone's tired of answering screening questions, but actively asking screening questions continues to be required as per the Ministry of Health guidance. Because breakthrough COVID infections are being seen in the vaccinated population, it's still important to screen every patient and staff member that attends for in-person care in all settings.
Okay, thank you. We do have 5 to 10 minutes left, so I'm going to take this other question. It's about virtual care, and this has been asked a lot recently. Can I continue to provide care to my patient if they move to Florida or Spain or California for the winter?
Well, the answer is it depends. One of the first steps, the answer that no one enjoys, but one of the first steps to providing a safe virtual care experience is to confirm the patient's physical location. So this is for two reasons. The first is you need to make sure that you meet the legal requirements to be able to provide care in the jurisdiction where the patient physically finds themselves, even if it's a temporary situation. So if physiotherapy is regulated in that jurisdiction, it's your responsibility to ensure that you meet the requirements of the regulator to provide virtual physiotherapy care. The second reason for confirming location is that you want to know what the contact requirements are for emergency services in their area. You need to have their exact address so that you could provide it to 911, for example, if there is a real emergency. If someone's not physically in North America, 911 may not be the right number to call or contact if there's an emergency. If your patient's going to another province within Canada, you'll likely need to register with that province's physiotherapists college for a cross-border registration. And those can be achieved by contacting the colleges in those provinces. There are two exceptions. If a patient resides in Nunavut or in the Northwest Territories, because they don't have regulatory colleges, you need to have a valid certification or registration with another college in one of the provinces in Canada. The other exception is when an Ontario resident is temporarily in Quebec at a private residence. and they will be returning to Ontario. Quebec has told us that you don't need to register with them to provide virtual care to that Ontario resident who is temporarily in a dwelling in Quebec.
Okay, well, I'm looking at the time, and I think it's time to wrap it up. So I want to thank everyone so much for taking the time out of your day to join us or to watch this webinar. It's really great to have a chance to answer these common questions. We hope you found the session helpful. If you've not already, we hope you'll reach out to us, the advisors. If you have a question or looking for a resource or need to talk through a difficult issue, we're here for you. One of the services the college offers is free and confidential. We also hope you'll let your colleagues and others know that they too are welcome to get in touch with us. We welcome calls from physiotherapy residents, students, employers, assistants, and other stakeholders, and particularly the public. So again, thank you for joining us.
Thank you.